1, 2, audio level check. 1, 2, level check. 1, 2. 1, 2. 1, 2. Level check. 1, 2. Press level check. 1, 2. Press level check. 1, 2. 1, 2. 1, 2. You guys good over there? 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. Yep. 1, 2. Yeah. You want it off? You want it off again? 1, 2. 1, 2. One, two, 1, 2. Too hot to you? Yeah, we can turn it down. It's just crackling. Sounds a little hot there. Audio level check. 1, 2. 1, 2. Level check. 1, 2. 1, 2. Level check. 1, 2. 1, 2.
everyone. Thank you so much for coming. It's a really historic day here at Baylor University Medical Center at Dallas. We have a representation of the clinical trial team. Not everyone could fit on the stage, so please know that there are others who are either out in the crowd or actually seeing patients today who are not here with us, but we wanted to make sure that we had enough here so you could get some questions answered about this amazing milestone. We're going to start with a video that will be played on the screens, and then the president of the hospital, Doug Lawson, will be here to introduce the team. We will be live streaming this news conference, so we have a dedicated link on YouTube that's live streaming that, and then our newsroom can take any additional inquiries. Once the hospital president introduces the team, they'll be talking about the trial for a little while. We'll take a few questions and then end, and then we can do additional interviews kind of one-on-one following the conference. Again, thank you so much for being here, and we'll start with the video.
On this day, a multidisciplinary team at Baylor University Medical Center in Dallas prepares for the culmination of a landmark clinical trial. A moment that represents a new chapter in infertility treatment research. A woman with absolute uterine factor infertility, or AUI, is in the United States. This child is giving new hope for some women who believed they'd never be able to give birth, now made possible and replicated at Baylor with a transplanted uterus from a living or deceased donor.
We're fortunate to live in an area, work in an area where we see miracles every day, and hopefully that's going to be another one of those miracles too.
Obviously this day is for the parents, and this is their biggest day of their lives, but I would say that also the physicians and all the nurses that worked with this, we are super excited, and it's one of our best days of our lives too.
I get emotional, even now. After 7,000 babies, it's still that special.
Well, good morning, everyone. Welcome to Baylor University Medical Center. My name is Doug Lawson, and I have the unique honor of serving as the president of this hospital and working with teams like this on a day-to-day basis. We are excited to have you here today as we discuss this exciting news and the first baby being born in the United States following a uterine transplantation. This is an exciting time for the family, for Baylor Scott and White Health, and for the research community as a whole. We celebrate this milestone alongside the family, the highly skilled team of staff, clinicians, and researchers at Baylor University Medical Center and Baylor Scott and White Research Institute, and whose work means that now more women with this need may be able to get pregnant and carry their own child. Baylor University Medical Center is proud to be part of Baylor Scott and White Health, and this work is a reflection of our system's commitment to innovation at the highest level. An achievement like this is only possible with the support of many leaders, many of whom are here today. I'd like to take a minute to recognize in particular our Chief Executive Officer, Jim Hinton. Jim, thank you for your support and leadership. Let's give Jim a round of applause. Our organization has a long history of first and a century-long commitment to driving medicine forward for patients, families, and the communities that we serve. Baylor University Medical Center is home to one of the nation's top transplant programs and a team of specialists in gynecology, obstetrics, and maternal and fetal medicine who are experienced in managing high-risk and incredibly complex cases. We hope that this innovative work and the observations of our research team will contribute to a growing body of knowledge at a national and international level. This is truly a great day for medical research, clinical care, and the families that we're called to serve, and we are especially proud to be here supporting them today. Now you'll hear from the team who made this milestone possible. And to start, I'd like to introduce Dr. Juliana Testa. Dr. Testa is one of our very senior leaders in the organization. He is a medical ethicist and speaks nationally. and I'm proud to call him a friend. He's also the principal investigator and instigator of this particular landmark trial at Baylor University Medical Center. So let's welcome Dr. Testa. Dr. Testa.
Good morning, everybody. It's for me a great honor to be here today. I'm honored and I'm very humbled by the news that we were able to bring about. It is my pleasure and my distinct honor to introduce the member of the team. These professionals, each of them, of course, has other people who have worked very hard. This is not only us. This is the entire institution behind us, from nurses to coordinators to assistants. Everybody has worked extremely hard to make this possible, and I'm extremely proud of belonging to this institution, and I really want to say that. So let me start from the right side. Michael Putman, he was instrumental. He's called maternal reproductive. He was instrumental in the implantation of the embryos and make sure that everything went smoothly when the time came. Christine Wallace is our coordinator, and she is the one who kept everything together, discussing with the families, with every member of the team. And you've heard and you've seen already Robert Gambi. He's an obstetrician gynecologist, as one of the senior personality in this institution, and of course he did a lot throughout the pregnancy to make sure that everything went smoothly. Colin Kuhn from the very beginning, he is again an obstetrician and gynecologist, does surgical oncology, but reality is that he was our partner from the beginning. With him, we started thinking about how to bring this forward. If I can go this way, Lisa Johannesson, I think she's an hybrid. She's the first of her kind. She's an obstetrician gynecologist by trade, but she's learning very fast to be a transplant surgeon, and I think she's leading the way for a new brand of doctors out there. And she's originally from Sweden, but joins us and is part of the staff now. Tiffany Anthony, longtime friend and transplant surgeon here, instrumental in many other things we do, but extremely helpful in, especially in all the recovery that we've done and the development of the techniques we've been using for the donor. And Gregory McKinnon, a friend and a partner in the transplant world that has been side to side with me in all the transplant, even on the nights that we didn't have as much success as we are enjoying today. So that's the team. I'm simply humbled to be between all these friends and colleagues, and I'm very proud of what we were able to achieve for this woman. And to my heart goes out to all the women who really trusted us in this journey. It was difficult in the beginning, and we understand that sometimes you have to go through difficulties to be able to enjoy moments like this. But now when you see this boy, you really feel like you've done something beautiful, pure, natural, and your medicine where is very, very good to see it. Medicine is really at the pinnacle. Thank you so much. Thanks. Do I take questions? I don't know. I'm told that
We'll take a few questions now on people and maybe they come on. Do we have any questions from the news media?
Can you talk about, this is for anyone, can you talk about the difference between this type of transplantation and a different organ, and the process and the length of time that these donors and recipients really had to experience?
Tiffany, Greg, transplant surgeon.
I'm okay.
Go ahead.
Well, I think any of us transplant surgeons can speak to this, but you know, as transplant surgeons, we generally take care of people with end-stage organ disease, and you know, when we do the transplantation, there's generally sort of we see the organ working, you know, immediately. So the sort of life-saving, life-giving aspect of it, having the donor and then transplanting the uterus and then waiting to see if the uterus became functional, and then waiting to see if we would have implantation of the embryo and that the patient would become pregnant, and then ensuring, all of our OB-GYN colleagues ensuring that the woman stayed healthy and the baby stayed healthy during the pregnancy. So there's a lot less of sort of an immediate gratification that we normally get with our transplants, and so this has been a long run for us compared to what we normally do, but definitely worth it.
I mean,
all of us would agree with that.
A kidney transplant, whether it's working in seconds, and this, ultimately, it's a year plus before we found out, so there's a big difference between seconds and years. So.
What are the implications for perhaps other diseases? What have you learned here that can be used to fight other diseases?
Well, this is the beginning of a long journey, not only for women in general. We want to make sure that people understand this is not the solution, it's one of the solutions. If a woman has absolute uterine infertility, this is one of the solutions out there, like adoption is or surrogacy in some states. But then there are scientific implications that have to do with immunosuppression, have to do with maternity itself, have to do with the status of other organs throughout this process. So it's opening a lot of new light, and it's so early. It's fascinating to be at this point at the present time.
Hi.
Yes.
So many are curious about mom and baby. Were there any complications during pregnancy, and did she carry the full 40 weeks? Is this a full-term baby?
Bob, that's yours.
Well, the patient has asked us not to say exactly how far along she was, but she carried to the pregnancy as long as most of the ones in Sweden had done. So we're in the ballpark, and they've both done fine. The mom has already gone home. The baby is on room air and eating, and the mom is anxiously awaiting him to come home. So they did.
Pregnancy was easy, or were
Well,
complications?
it was sort of what we expected. Immunosuppressive drugs have some effect on the mom. As far as we've been able to tell over 30 years, it's never affected the baby any. And they both did great.
I don't think is there such a thing as an easy pregnancy?
I was going to say, you're going to have to ask the Bob that question, because
Yeah, we are the last one, the male part of this are the last one who can answer that question, but I can tell you that it was not easy for us.
These are very stressful. I mean, starting with the first liver transplant that we did here 30 years ago, I mean, we were flying by the seat of our pants, had no idea what we were really doing, what the medicine was going to do. And so Kristen, thank goodness, babysat us and the patient 24 hours a day. So, I mean, she deserves tremendous
She does.
respect for this, because she has shepherded us all through this and kept up with the mom. Every sniffle she had, every time she fell, I mean, we were just panicked that something was going to happen to the pregnancy. And so it was difficult just because of the intensity of this.
How many other women, can you tell us, are involved in this clinical trial, and are any of them pregnant right now?
So we have permission to do 10 transplants, and we've done 8 so far. We can reveal today that one more is in an advanced stage of pregnancy, and the other ones are in different stages of the procedure. And we have promised to reveal that not where they are at the moment, but they are in different stages.
Are you talking about the language barrier?
Yeah.
This is what I said before. I truly believe, and is the fact that this is really what medicine should be today. This is academia in its best expression, because what happens is that we start sharing information right away. Of course, we gain tons by having Lisa here, and in the moments where we really didn't know what was going to happen, Lisa was the voice that, no, I've seen this. We can go forward. Everything is fine. We are in constant communication with a few other groups in the world and in the United States who are looking into this procedure. Some of us are a little more advanced just because we started earlier. But this is beautiful. The communication is constant. We learn from each other. Things that happen in Sweden didn't happen with us and vice versa. So now we are kind of comparing notes. And I'm very excited about what will come in the future, because the reality is that this procedure will become easier on the woman, on the recipients and donors, and easier for everybody. Christine, why you address this?
So we had a lot of donors step forward and are continuing to step forward, and we're extremely thankful for them. We were very surprised. I think we were expecting to have people related to the recipients, and we had so many more women that were selflessly willing to go through the screening, which is the best physical they ever got, and be willing to at least look into this. It's not right for everybody because it is a major surgery, but we were definitely overwhelmed by the initial interest and are continuing to be overwhelmed. And it's great, and we can't wait to talk to everybody. It will take a little bit of time because there's a lot of interest. So I promise I'll get back to everybody, but there's a lot, and we're very thankful for that. So we hope to be able to help a lot of women.
And we can,
Yes,
yes,
it was.
we can just add to that also that the donors in this trial is altruistic, meaning that they don't know the recipient. So they volunteered without knowing who they were going to donate to, and that's unique. In Sweden, we all had directed donors. They were relatives or friends of the recipient. So this is completely new, and that's, as Kristen said, we were overwhelmed by that, and we continue, since this news were released on Friday, we get a lot of new donors that are interested in giving up their uterus. So that's truly remarkable.
Colin, you want to address this?
Yeah, that's an awesome question. It's not only that, so the absolute uterine infertility factor, it affects about 1 in every 500 women. And it's not just the amount of women that it affects, but it's also the emotion that these women have. That as young women, 14, 16 years of age, they're told that they never have a chance of having their own babies and carrying those babies. And this is providing those women hope now. And that's the whole focus, and our focus previously was being able to restore hope to these women who have been told that they weren't ever going to be able to have their own children.
Someone on the video mentioned they delivered thousands of babies. Who was that, and can you tell me what your emotions were like when you heard that?
I'm not sure who that was.
Who's got the most gray hair up here?
We may just have it covered.
Yeah, two Brute. Oh. I have delivered thousands of babies, as represented by my gray hair. And every single one is very exciting, but there was something about this that was so special. Sorry, I'm an emotional person. There was something so exciting about this because the patients are so excited. And it's just what they're willing to go through to get to this point is just overwhelming to me. And so this was a very special event. After all that I've delivered, this is probably the most special one. I don't want any of my other patients to hear that, but
Yes.
How many calls have you all fielded since Friday, since the news broke? How many other women are reaching out saying, I've been told never, and now you told me
Well,
that never has fallen?
we have close to 200 inquiries, but some of them are donors and some of them are recipients. So I've not been able to completely go through them all yet, but I'm working on that very shortly.
That's a very, very good question. We're working on that, meaning that to date, the only live birth in the world occurred from living donors. But we have performed also successfully a diseased uterus transplant in a woman. And there is another team that is also, 2 teams in the world that have done successfully this transplant from a diseased donor. The expectation is that they should work the same. The truth is, for the time being, we know only about living donors. selection of the right donor will be, in my opinion, the number one question for the future of this field. We'll get there.
So I can just address that. We have promised this particular mom to not say what her wishes are and if she removed the uterus or not. But I can speak for Sweden. The trial we had there, we had 7 women with a viable uterus after the transplant. 6 of them have delivered babies, and 2 of those had delivered 2 babies each. So it is possible, but that's a decision we as a medical team take together with the parents.
It's part of our protocol. The protocol speaks for a possibility of a second pregnancy if everything goes smooth through the first pregnancy. But again, the decision is a common decision, mutual decision among all of us, the member of the team, and the family.
But they are, when they decided not to go through another pregnancy, or we together decide, we do remove the uterus. And that is because they're not supposed to be on immunosuppression for a very long time. So you have it for the pregnancies, and then you remove the uterus and you can cease taking immunosuppressions. Is there a time sensitivity then for them to decide? Well, no one knows really, because this is such a new field. We have said that about 5 years is a reasonable time period if you would go for 2 pregnancies to have the uterus from the transplant to removal. But this is in the future for us to see.
I don't think we're sharing that.
Unfortunately.
No.
It's top secret.
Baby number 9.
Beautiful baby
Yeah.
boy.
Yeah.
We'll take just a couple more questions and then do additional.
No questions.
Any last questions?
Well, I guess, just where is this headed? Where is this going? Are other parts of the country going to start working on this even more rapidly, probably, since,
Well,
you love being number 1 here.
I think Lisa said it correctly. The only real success, aside, of course, from the live birth, is going to see how many institutions will embark in this adventure. We know for sure that there are at least 3 or 4 major institutions in the United States who are starting or are willing to start a uterus transplant program. My personal opinion is that this is going to affect many women in the United States. They will see this becoming part of one of the possible solutions to absolute uterine infertility. We all here, we are very humbled by understanding the depth of the desire of a woman to carry her own pregnancy. It was probably the one thing that as a man and as a father even, I totally underestimated. And now there is this possibility. And so I think that in the future we'll see this blossom into a great field for the benefit of the woman, number 1, and number 2, for advancement of field of transplantation and obstetric gynecology, fertility medicine altogether.
What this first does is that it really confirms that this is doable. This is a procedure that can be replicated in other centers than the center that started. And that's very important for all the centers worldwide that's starting up this now, to know that they can do it. It's possible.
But today is great to be a Baylor. I have to say that. It's a great honor.
And also, innovation often feeds innovation. The fact that this is happening here, what's the long-term impact for people who live in North Texas?
They have an opportunity. The women have another opportunity. There is, as Colin said, there is hope now. And we hope to be really the one that are continuing to lead in this field and to make this as possible and for as many women as possible. Not only for North Texas, of course, we are very happy to be here, but for the entire country and for the rest of the country.
And for the world. I mean, this has got to be a collaborative effort.
Yeah.
This cannot be just a Baylor University Medical Center project. While we started the project here in the U.S., and this is the first birth outside of Sweden, it's got to be a world project. And as Giuliano has already discussed, this has already opened up unbelievable collaborations. And the fact that the Sweden team was willing to come here for our first 4 transplants was just unbelievable. And the amount of information that's been shared is just awe-inspiring, because this is the way it's supposed to work. It's not supposed to be, you know, kept secret and just have us do this, but this is supposed to be the way that science is supposed to advance, and it's wonderful to be a part of that.
And the more centers that do it, the more efficient it's going to become, the more successful it's going to become, and the key to making it available to everybody is expanding to as many centers as we can do.
Thank you.
Thank you.